Today we'll be talking about the players who can't resist the temptation to have an illegitimate advantage on the field by using illicit drugs.
We'll be talking about how the different kinds of drugs affect the body and what advantages it gives the player on the field.
We'll explain the risks of taking these drugs and how they lead to serious injury and sometimes death.
It will also be discussed how drug tests are conducted and the punishments for using these illicit drugs.
Drug tests are usually in two stages, both with the urine being tested. The first stage is called the immunoassay. It's quick and cheap, but at times can have illegitimate results. For example, it can give false readings and can miss opioids that are present in the player's system. If the results from the first test come back positive, but there's still a denial by the player, then a second test will be conducted. This test is called gas chromatography, or mass spectrometry. It is also a urine test, but unlike the other tests, it takes longer and is also more expensive. However, its results are more accurate.
The ASADA, Australian Sports Anti-Doping Authority, is the authority on drug use in sports. There are many rules associating drug cheating in sports, and these are some of them. Presence of a prohibited substance or its metabolites or markers in an athlete's sample. Use or attempted use by an athlete of a prohibited substance or prohibited method. Refusing to give in their sample of drug testing. Tampering or attempting tampering with any part of doping control. Possession of prohibited substances and prohibited methods. Trafficking or attempted trafficking in any prohibited substance or prohibited method. Athletes who do disobey the rules and get a positive reading for the use of illicit drugs then get assessed by the Anti-Doping Rule Violation Panel, ADRVP. And if they agree that there was a violation, the athlete will then have to go before the sports tribunal where the punishment will be decided. An example of a drug cheat was a man named Christopher Ciancio, who used multiple illicit drugs to get an advantage in his weightlifting competitions. He was then sanctioned by the Australian Weightlifting Federation for a 4-year suspension. This just shows that even though punishments can be so severe that it may result in a lifelong ban, athletes still take the risk of drug cheating to try and get an advantage over others in sport.
Even though drugs help improve the athlete in their sport, there are also many risks in taking them. We have chosen a few of these performance-enhancing drugs to discuss. Androstenedione. The manufacturers of it and bodybuilders say its ability to allow athletes to train harder and recover more quickly is very beneficial.
The risks of the drug are acne, diminished sperm production, shrinking of the testicles, and enlargement of the breast.
Human growth hormone, also known as gonadotropin. It is a hormone that helps athletes improve their muscle mass and also their performance in their sport.
The risks involved with this sport is joint pain, muscle weakness, fluid retention, carpal tunnel syndrome, visual problems, impaired glucose regulation, enlarged heart, cardiomegaly, diabetes, and high blood pressure, hypertension.
Erythropoietin increases the production of hemoglobin, which is in the red blood, which carries oxygen around the body.
This drug increases the risk of thrombotic events, such as strokes, heart attacks, and pulmonary embolism. It has also contributed to at least 18 deaths.
Creatine has been scientifically proven to benefit some athletes by providing small bursts of energy. Creatine appears to help muscles make more androstenedione triphosphate, which stores and transfers energy in the cells, and is used for quick bursts of energies, which is useful in sprinting or weightlifting.
The risks involved with this drug are stomach cramps and muscle cramps. High-dose creatine use may potentially damage your kidneys, liver, and weight gain.
Thank you for listening to our presentation about drugs and sports.
I hope this has been informative to you. Thank you. And there is still denial by the player, then a second test will be conducted. This test, named gas
Chromatography! Today we'll be talking about the players who can't resist the temptation to have an illegitimate advantage on the field by using illicit drugs. Why? You could keep talking! Today we'll be talking about the players who can't resist the temptation to have an illegitimate... What?